Okay, quick exercise. Picture the pill bottle sitting in your medicine cabinet right now. The one you take every single morning, probably without even thinking about it anymore. Now be honest with yourself for a second. Do you actually know what that pill is doing inside your body while you sleep? Or have you just been trusting the label all this time? No judgment if the answer is not really. That's not on you. Doctors are busy, appointments are short, and take one daily doesn't exactly come with an explanation. So that's what we're fixing today. Here's something a lot of people assume, and it's actually not quite right, that all blood pressure pills basically do the same job. Lower the number, done, end of story. But that's not how it works at all. Amlodipine, Losartan, and Lisinopril go after high blood pressure from three genuinely different directions. They're not interchangeable. They're specialized. And once that clicks, a few things start making sense. Why your doctor picked the one you're on, why you might have been switched from one to another at some point, and why your side effects look the way they do. So let's use a picture that makes this easy. Think of your blood vessels like a network of garden hoses running through your whole body, and your heart is the pump pushing water, blood, through all of it. There are really only three ways to bring the pressure in that system down. You can widen the hose itself, so the same amount of water moves through with less force. You can block the signal that tells the hose to squeeze tight in the first place. Or, and this is the clever one, you can stop that signal from ever getting made at all. Amlodipine widens the hose, plain and simple. Losartan blocks the tightening signal before it can land. And Lisinopril stops that signal from being created in the first place. One step earlier in the chain. Same destination, a lower number on the cuff, but three completely different roads to get there. And which road your medication takes is exactly why your side effects are the ones they are. Let's go through them one at a time. First up, amlodipine. It's in a class called calcium channel blockers, and true to our garden hose picture, it relaxes the muscle in your blood vessel walls directly. The hose widens, blood moves more freely, pressure comes down. It's a once-a-day pill. It's fairly forgiving if you forget a dose here and there, and unlike a couple of the others we'll get to, it doesn't cause that dry, nagging cough some blood pressure medications are known for. Now here's the trade-off. Because amlodipine widens blood vessels, especially the small ones down in your lower legs, fluid can end up pooling there by the end of the day. That shows up as swelling around your ankles or lower legs, sometimes enough that you can see the sock line pressed into your skin by evening. Some people also notice a bit of flushing in the face, a little dizziness when they stand up too fast, some changes in the gums, or constipation. Let's talk about Margaret for a second. 76. Been on amlodipine for a couple of years. Every single evening her ankles would swell up until her shoes felt tight. And for the longest time, she just chalked it up to being on her feet too much. Or, getting older. It wasn't until she mentioned it almost as a throwaway comment to her pharmacist during a refill that anyone connected the dots. Turns out it wasn't age at all. It was the medication doing exactly what it's known to do. Her doctor wasn't worried. This is a well-recognized, manageable side effect. But they were glad she brought it up, because there are simple fixes, like elevating the legs in the evening or adjusting the dose. And honestly, that's the mistake I see over and over, writing off ankle swelling as just getting older instead of mentioning it. It's a known effect of this specific drug, and your doctor genuinely can't help with something they don't know is happening. So, if this sounds familiar, if you've noticed your ankles doing this by dinner time, drop a comment below. I'd bet you're not the only one in this comment section nodding along right now. Moving on to Losartan. This one's in a class called ARBs, angiotensin receptor blockers. And don't worry, that's the last bit of jargon, I promise you. Remember that tightening signal from the garden hose picture? Losartan basically jams the lock so the key doesn't fit anymore. There's a hormone in your body called angiotensin 2, and its whole job is to tell blood vessels to clamp down and tell your kidneys to hold on to sodium, both of which push your blood pressure up. Losartan blocks the spot where that hormone would normally attach. The signal just can't land. Vessels relax, kidneys let go of some sodium, and pressure drops. Here's something worth knowing about this one. Losartan tends to be protective of your kidneys, which is a big reason it gets prescribed for people dealing with both blood pressure and kidney concerns at once. It also tends not to mess with mood, energy, or sexual function the way some other blood pressure medications can, something a lot of patients wonder about but rarely ask out loud. What should you watch for? Mainly, this one can nudge your potassium levels up, and it can affect kidney function, especially if you're sick, dehydrated, or just not drinking enough water. Which is exactly why routine blood work matters here. Not because anything's wrong, but because this medication needs an occasional check-in to make sure everything's still balanced. Let me tell you about Robert. 68 years old, on Losartan for about 3 years, felt totally fine the whole time, no symptoms whatsoever. His doctor's office called him twice to get his routine labs done, and twice he blew it off. Because, well, why get blood drawn when you feel perfectly normal? When he finally went in, his potassium had crept up higher than it should have been. Nothing dramatic, but exactly the kind of thing that's simple to catch early and a lot more annoying to deal with once it's been ignored for a while. That's really the personality of Losartan. It's the quiet one. It doesn't usually make you feel anything, good or bad, which, ironically, is exactly why it's so easy to forget it needs monitoring. The mistake people make is assuming no symptoms means no need for labs. With this particular drug, it's the opposite. The labs are kind of the whole point. And finally, Lisinopril. This one's an ACE inhibitor, and it works one step earlier than Losartan on that same exact pathway. Instead of blocking the hormone from landing where it's supposed to, Lisinopril stops your body from making the active version of that hormone in the first place, cutting it off before it even exists. It's inexpensive, it's been studied for decades, and it's also kidney protective, which makes it especially useful for people managing diabetes alongside high blood pressure, since kidney health tends to be a bigger concern in that combination. Now, the thing Lisinopril is famous for, and if you've taken it, you already know exactly what I'm about to say, is a dry, persistent cough. No mucus, no illness behind it, just an irritating tickle in your throat that won't quit. This, by the way, is the #1 reason doctors move patients off an ACE inhibitor like Lisinopril and over to an ARB like Losartan. You might also get a bit of dizziness with your very first dose while your body adjusts. And just like Losartan, your potassium needs the occasional check. So if you've ever been switched from one blood pressure pill to another and nobody really explained why, there's a decent chance this is the reason. Let me tell you about Dorothy. 72, started Lisinopril, and a few weeks in developed this dry cough that just wouldn't go away. She figured it was seasonal allergies. Tried allergy medicine. Nothing touched it. It wasn't until her follow-up appointment that her doctor asked the right question. When exactly did the cough start? And traced it right back to the new prescription. She was switched to Losartan, and within a couple weeks, the cough was completely gone. If any part of that sounds familiar, maybe you're the one who got switched, or maybe you're dealing with that exact cough right now and just haven't connected it yet, you are definitely not alone. We might put together a full video comparing Lisinopril and Losartan head-to-head, so let us know in the comments if that's something you'd want to see. Alright, here's something that ties all three of these together, and it's worth sticking around for regardless of which one you're taking, or even if you're on a combination of them. Let me be really clear about something first, though. Not everyone on these medications gets dizzy. It depends on the person, the dose, how hydrated you are, and a handful of other factors. Plenty of people take these for years and never notice a thing. But because all three of these drugs work by lowering blood pressure, dizziness on standing up, the medical term is orthostatic hypotension, is something that can happen with any of them, so it's worth knowing what to do if it ever does. A few habits that genuinely help. When you get up, especially first thing in the morning, try rising slowly. Sit on the edge of the bed for a moment before you stand all the way up. Give your body a few seconds to catch up with you. Staying hydrated matters too, since dehydration makes this more likely. And it's worth being a little cautious with hot showers and alcohol, since both can drop your blood pressure further on their own. But the most important thing, if you ever fall, or even just catch yourself before one, tell your doctor. Don't file it away as just getting older or just clumsy. That's exactly the kind of thing worth mentioning, because a simple adjustment might be all it takes. Before we wrap up, a quick toolkit of habits that go with any of these three. If you check your blood pressure at home, try to take readings at the same time each day, and give yourself a few quiet minutes beforehand. Running in from an errand and immediately checking will throw the number off. Also worth knowing, your target range isn't necessarily the same as your neighbor's. That old 130/80 for everyone rule doesn't really apply the same way to every person, especially depending on your age and what else is going on health-wise. Your doctor sets your target based on you specifically. A couple more habits worth building. Know your missed dose rule, since it's different depending on the drug. Check with your pharmacist before adding any over-the-counter medication or supplement, since a few, like certain anti-inflammatories or potassium supplements, can interact. And always tell your surgical team about all three of these before any procedure, even something minor. Look, everything in this video is meant to help you walk into your next appointment more informed. It's not a replacement for one. Please don't stop, start, or adjust any of these medications on your own. And if you ever experience severe dizziness, fainting, sudden swelling, or a racing heartbeat, that's worth getting checked out right away, not something to wait out. So, I want to hear from you. Which of these three are you on? Amlodipine, Losartan, or Lisinopril? And did any of the side effects we covered today catch you off guard? Tell me in the comments. And if this helped you understand your own prescription a little better, go ahead and hit subscribe. We put out a new senior health breakdown like this every week, because you've spent a lifetime looking after everyone else. It's about time somebody explained what's going on with your own health, too. Thanks for watching. I'll see you in the next one.